Hello, everyone. I am Dr. Octavio Santos, co-chair of the Student Pipeline Subcommittee of the American Academy of Clinical Neuropsychology's Relevance 2050 initiative. I want to welcome you to the 5th webinar on board certification through the American Board of Professional Psychology, or ABPP for short. This webinar is brought to you by our Student Pipeline Subcommittee and the AACN Board Certification Promotion Committee, in collaboration with the American Board of Clinical Neuropsychology and the Association of Neuropsychology Students and Trainees, or ANST for short. Today's webinar will focus on the importance of and the path to becoming board certified in clinical neuropsychology in Canada. During the webinar, please use the Q&A function to submit questions and be aware that this webinar is being recorded. Next slide. I would like to acknowledge the hard work behind the scenes of our subcommittee members to make this webinar possible, as well as to give a special thanks to my colleagues for supporting this webinar. We encourage you to visit the AACN website to view previously recorded webinars on board certification. Today's webinar's recording and presentation slides will be posted on this website in the next few days. We kindly ask you to complete an evaluation following this webinar to give us your feedback and to have a chance to win one of several neuropsychology books that will be raffled. Next slide. Now, it's my pleasure to introduce our speaker, Dr. Ronak Patel. Dr. Patel completed his PhD in clinical psychology at Ryerson University and his internship in neuropsychology and cognitive health at Baycrest Center for Geriatric Care in Toronto. Dr. Patel is currently a clinical neuropsychologist and assistant professor in the Department of Clinical Health Psychology at the University of Manitoba. He's actively involved in teaching and is a primary rotation supervisor in the CPA accredited clinical health psychology internship program at the University of Manitoba. Dr. Patel was recently awarded board certification in clinical neuropsychology by ABPP. Dr. Patel specializes in neuropsychological assessment and neurorehabilitation of a stroke and traumatic brain injury. Dr. Patel maintains a research program where he uses the latest neuroimaging methods to advance our understanding of brain and behavior relationships across different clinical populations. Thank you, Dr. Patel, for accepting our invitation and for joining us today.
Great, thank you, Octavio, for that introduction. And thank you, everybody, for joining us on today's webinar on board certification, and specifically the process of board certification for Canadian trainees who are considering, or Canadians in general, who are considering the process of becoming board certified. So an overview of our presentation today, we wanted to talk to you guys about what are the different benefits that are associated with board certification, especially in the for Canadians. Frequent questions that come up. Throughout our presentation, we're going to try to give you our different perspectives and experiences and reflections from Canadians who've gone through this process. We'll also cover some of the very basic steps towards applying for board certification and talk to you about some of the strategies we used, as well as resources available to help individuals through this process. We also have some information about colleagues around the country who have gone through the process and kind of what their training looked like, as well as their different timelines of going through the process. And we definitely want to leave lots of time for question and answers that you may have as you think about this endeavor. Okay, so I think the biggest question for Canadians that often comes up is, why bother with pursuing board certification? And it's a fair question. So I think one of the things that comes up the most, or one of the answers that we often think about to this question as to being the main benefit, is one related to competency. So when somebody goes through the American board certification process in clinical neuropsychology, you are meeting the highest practice standard that exists in your field. And so board certification is the highest benchmark of competency to practice clinical neuropsychology. And this is the highest benchmark that you can obtain in our field anywhere in the world. And so the question then becomes, well, why is it important to achieve this level or highest level of competency? I think there are a lot of different answers to that question and a lot of different reasons. For me, one of the main ones, and I think that goes in hands with competency, is to be confident that you are delivering the highest level, highest quality of clinical services to your patients. And having board certification and going through the board certification process certainly helps you be able to deliver the highest quality of services to your patients. And so meeting that standard of competence really sets you and distinguishes you from others who may be practicing in the field and don't have as robust training, or even those who are practicing in the field and probably shouldn't be practicing in the field because they have very little training. So again, board certification really allows you to distinguish yourself from others who might be practicing in areas that overlap or areas that are very similar to neuropsychology. One thing that often comes up, and people will say, especially in Canada, so my supervisors and many of the neuropsychologists I respect are not board certified, so why should I be? And I think also this is a fair question. Most of the people that I trained with, who I have the utmost respect for and who are my mentors to this day, were not necessarily board certified. Because I've done all my training in Canada, and that was certainly the case. But as we know, there's a few reasons to consider beyond the competency, beyond the reasons related to competency, why one might consider getting board certified. So we know that board certification has really increased and over the years. So if you look at this bar graph, regarding the number of diplomas that have been awarded for board certification in clinical neuropsychology, I mean, you can just generally see there's been an increasing trend, and the trend has grown very rapidly. And certainly we know in the States, this has become the norm, the standard for our field is to become board certified. And so it is something that has steadily gained steam over the years and continues to gain traction. And again, it's really become the normative standard in the United States. It is the fastest and continues to be the fastest growing specialty of any other ABAP specialties. And so again, that's reflected in the numbers here, where I believe the ABCN board and those affiliated with it are really pushing towards having most of its members and having most of practitioners in the field of neuropsychology board certified. If you extend beyond kind of just the US and you go to network organizations such as INS or SEN, a good chunk of the membership, a good percentage of the membership and its members are board certified. So certainly this allows you to establish yourself amongst your peers when you are networking or when you are part of these other organizations as well. So on this slide, we've just collected some testimonials from people speaking to what they got out of the American out of board certification. And certainly one of the major highlights, and this is especially true of me, is your level of expertise. So the process really, so I'm just going to read off some of these quotes: deepened my understanding of the interplay between brain and behavior relationships. Going through the process will help you expand, consolidate, refine your knowledge as a practitioner or researcher in neuropsychology. Somebody else states, I honestly have never felt more competent in my skills than after studying, especially for different topics like neuroanatomy and pathology. So you can see certainly, and I think everybody who's gone through the board certification process would agree, you really come out feeling like you've deepened and broadened your expertise in neuropsychology, and really kind of achieved the deepest level that you can in your field. This adds, of course, to your confidence. So, just having an increased and richer knowledge base adds to, increased self-confidence, as well as the respect from other colleagues and your interactions with other colleagues. It all helps to serve your overall confidence, especially when you are progressing towards autonomous, independent practice. We know that it also, board certification adds to and really establishes your credibility. As I said, in the States, it's become the norm, but not only for the field of clinical neuropsychology, but board certification has become the norm for many medical health professionals and medical specialties. And so we are trying to aspire to this as well, where we want to be also considered on par with our colleagues in other areas of medicine who are also board certified. Again, going through the process really identifies you as a specialist in your field and one that has been vetted by your peers. And it differentiates you from generalists who are calling themselves neuropsychologists and giving neuropsychological tests. And I can, many of us who are practicing can certainly attest to that. You are going to see a lot of practitioners who are kind of dabbling into cognitive assessment or neuropsychological testing, who may not have the appropriate background to be doing the type of work that they're doing. And so this really differentiates you from those folks and clearly establishes your credentials as being the most competent individual to administer and interpret the tests that you're using. Another benefit that comes through this process is networking. So just going through the process connects you with a really wide community of experts in neuropsychology. And this helps to improve your practice and overall delivery of clinical care. And so certainly for me, this was true. I got connected with an American who was going through the process, and we became study partners. And we are still in touch to this day. He exposed me to a lot of resources that I wasn't aware of, and vice versa. And so just that sharing of information, sharing of resources, that all opens up the door to collaboration and to, again, just adding to your knowledge base. And the networking exists well beyond. Once you're board certified, you are then part of a group of board certified neuropsychologists. We have our own special listserv where we discuss different matters that come up in our work. And so you have access to a whole group of neuropsychologists if you ever have a question that you want further explored, or find yourself in a dilemma that you need help or input on. So the networking aspect actually can't be underestimated because it is a big part and advantage of being board certified. Certainly in terms of establishing yourself and your credentials, if you are in doing medical legal work or in forensic practice, lawyers certainly do know about board certification and will use it to establish credibility in their legal proceedings. And this makes it fairly easy to meet criteria as an expert witness when you do have board certification, if you are doing medical, legal, or forensic work. So additional benefits to become board certified. So certainly in the States, we know that American board certified neuropsychologists earn more on average in terms of their overall pay, and are generally more satisfied with their work. Some institutions, and this is a little bit more geared to what's happening in the States, specifically linked to bonuses, link bonuses, promotions, and different hospital privileges to board certification. And there are many sites now in the States, as well as private practices, that require board certification at hire within a few years of hire. And that's, again, really because it's become the norm in the States to become board certified if you are practicing in the field of neuropsychology. And certainly if you see any job applications coming from the States or job descriptions, certainly board eligibility or board certification is always mentioned in almost every job posting. These are just some of the many sites, well-known sites, and predominantly, again, they are in the States, who require American board certification if you were to join their institution. Further testimonials from people who've gone through this process. So this person states, I recognize that completing a postdoc would potentially help increase the chances of accessing career opportunities across both Canada and the US, thereby increasing flexibility and mobility. So that's certainly true. Once you have once you've obtained board certification, that really does open you up to lots of options. If you ever did want to practice in the States, that would really certainly facilitate mobility in that way. But certainly within Canada, we recognize that you have achieved the highest level of training in your field, and certainly applying to different jobs, that's always going to look very attractive to any employer if you have board certification. And so, again, this in the second quote, by completing my fellowship, I was able to apply to neuropsychologist positions at medical centers across the US, where it is a requirement for employment that you are eligible for board certification. So yeah, that just goes back to, in the States, it's actually a requirement in most places that you would be applying for work. So it's really become the norm there to be going through the process. There is this misconception that you need to be in the field for X number of years to be board eligible or for you to be ready to sit for the written examination. There was a period where applicants did have to wait to be in the field for a certain amount of years, but this is no longer the case. So once a candidate completes the necessary training and licensure requirements, then they can be considered board eligible. And now American board certification has a process for early entry. It's called the early entry program, which we're going to talk a little bit more about, so that you can enter and get ready for the process of being board certified, even while you're in your graduate training. So the organization has really moved to make the process as attainable as possible for all candidates who are training and having a major focus in neuropsychology. And so they've started a few years ago. I don't actually know exactly when this started, but at least now several years ago, they started the early entry application, which allows graduate students to apply to be in the process while they're training. And so this is for graduate. So the early entry program is for graduate students, interns, or residents who can apply to the ABAP process early. And to be eligible for the early entry program, you still must be a trainee who's not yet licensed as a psychologist, and you must be in an APA or CPA accredited doctoral approved program. So I actually started my process by signing up for the early entry process, and it really kind of helped set me up for pursuing the whole process from start to finish. And it was a really nice way to get in early and for me to start thinking about making sure I have all the pieces that I need to become board certified. So let's walk through some of the steps that are required to obtain board certification. So as you know, as most of you will probably know, or maybe not, the general governing body here that oversees board certification is the American Board of Professional Psychology. And this is a governing body that comprises of 15 affiliated specialty psychology boards, including ABCN, so the American Board of Clinical Neuropsychology. You can see here it's highlighted in red. But there are also other subfields for which the ABPP oversees board certification in. For ABCN, or the pursuit of board certification in clinical neuropsychology, there are several relevant organizations. So you have, and this can get confusing, and so if you get confused with the different organizations, you're not the only one. I still sometimes get confused as to what is what. But so you have the American Board of Professional Psychology, who oversees the board certification process. And then within that, you have the American Board of Clinical Neuropsychology, who oversees the board certification process, specifically in clinical neuropsychology. As mentioned earlier, this is the fastest board within the organization. There's 1,479 specialists, ABN specialists to date. And it's the only subspecialty, it's the only specialty, sorry, to have the subspecialty of pediatric neuropsychology. So you can now also become board certified in pediatric neuropsychology. And there are 120 subspecialists with that designation to date. So you have ABCN. There's also the American Academy of Clinical Neuropsychology, or AACN. And this is a membership organization that's focused on advocacy and education in clinical neuropsychology. It's only comprised of board certified neuropsychologists. So when you become a board certified neuropsychologist, you get enrolled into the American Academy of Clinical Neuropsychology. But they are the ABAP, and it is separate. It's a separate legal entity from ABCN and ABP. So that can sometimes be confusing for people. And then, of course, there's the Association of Postdoctoral Programs in Clinical Neuropsychology, or the short form is called ABCN. And this is a set of postdoctoral programs that meet training requirements in clinical neuropsychology by the Houston Conference guidelines. And each program, each postdoctoral program here within the ABCN roster is led by an ABCN board certified neuropsychologist. And most of these programs we know are in the States, which we'll talk about some more in a minute. Okay, so kind of just the basic core steps of board certification. So the very first step is submitting an application. And again, if you're a graduate student, you can start this process now by going through the early entry program. And the nice part is that the fee for that application is much lower. It's $25 if you do it through early entry versus if you do it later, it's $125. These prices are all in US dollars, by the way. Once your application is approved, you can then sit for the second stage, which is writing your, which is the written examination. Once you pass the written examination, you can go on to stage 3, which is the submission of 2 work practice samples. And then if those are accepted, you move on to the 4th and the final stage, which is an oral examination. And so each stage is successive. So you can't proceed to the next stage until you've completed the stage and been successfully past the stage before it. So you must pass each stage before you go on to the next. As you can see, it can add up in terms of the fees that are associated with each stage, but there is a push to create more and more funding avenues and funding opportunities for people who are going through the process. And so we have a list of different scholarships that are available that people can apply for. And I can't remember if Octavio mentioned this, but we are going to put these slides and the links and all the information to a website for the participants. I don't know the information of exactly where that's going to be, but we'll let you know when we're in the Q&A exactly where you will be able to access these slides and some of the links that we have. Okay, so if we kind of go into number 1 there, so what are they looking for in the application? So the application is really a credential review to see what are your credentials in the field of neuropsychology. So the first thing they're going to look for is whether you have completed a doctorate or are completing a doctorate in psychology. With the eventual, so following the completion of your doctorate of psychology, you will have to show that you've registered with your state or provincial body to practice in the field of psychology. And they also want to review what training you've undertaken in neuropsychology. So in general, when they are assessing your training in neuropsychology, they want to ensure that your training conforms to the Houston Conference guidelines. And these are a set of guidelines that have been established that speak to what one requires to become competent in neuropsychology. And I believe we have a link in an upcoming slide to those guidelines for further review if you'd like to see what those guidelines specifically entail. There are specific training criteria for Canadian applicants that are available on the ABCN website, and we're going to go over those in more detail as to what they are exactly looking for from Canadian applicants. The nice thing about board certification is once you start the process, they start to bank your credentials for free as you complete your training. So if you are in the early entry program, they obviously don't expect you to have everything completed there because you're still a graduate trainee. And so as you complete the next stage of your training and those are confirmed, you send in those pieces of information into your application, and that gets reviewed and you get passed on to the next step accordingly. Okay, so we would definitely encourage you to look at the Canadian guidelines that are published on the ABCN website, because this is, of course, geared to Canadian applicants, and Canadian applicants are in a different situation than those who are in getting their training in the States. And of course, one of the major differences is that we don't in Canada have many two-year fellowship programs where somebody can do a formal postdoc in clinical neuropsychology. We have a few, but they are few in number and nothing compared to what's available in the States. And so ABCN recognizes that we don't have many formal fellowship programs. And so they've outlined these criteria as criteria for you to assess, okay, in the absence of a formal postdoc, what would I need? And so certainly they want to make sure that throughout your doctoral and pre-doctoral training, as well as through your postdoctoral training, that you have had didactic, academic, and clinical training that are consistent with those that are consistent with the guidelines set out by the Houston Conference. And so again, if you are going through a neuropsychology program in Canada at the graduate level, or are pursuing a major area of focus in clinical neuropsychology during your training, the likelihood is that you are meeting these conference guidelines. But again, you should be consulting those guidelines to ensure that you are. So following your doctoral and pre-doctoral training, moving on to a 2-year full-time postdoctoral training supervised practice by clinical. And so this 2-year postdoctoral training needs to be supervised by a clinical neuropsychologist. And during this training, one also needs to have access to an academic medical center to participate in didactics and different educational and training opportunities. So for instance, being able to attend patient medical rounds, being able to attend different academic rounds related to neuroscience, neurology, neuroanatomy, and also the connection to an academic center also possibly facilitates opportunities in research as well. So they want you to have the 2-year training, postdoctoral training in clinical neuropsychology, but they also want to make sure that you have access and are attending academic training opportunities on a regular basis during that 2-year period as well. It is okay, ideally, it would be nice if that could all be at one site and all wrapped up at one site. That certainly was the case for me here at the University of Manitoba. But it's okay if those things are at different sites. So if you're getting clinically supervised in one site and attending didactics at another site, they do allow for that. During your supervised practice, the postdoctoral training period, they are looking for you to get exposure and experience with a broad range of medical and neurological disorders. And they do want full scope training in all aspects of the neuropsychological assessment process, from clinical interviewing, testing, feedback sessions, and so report writing. So you should be providing all aspects of the neuropsychological assessment process, as well as if your site offers it, or if there are opportunities to deliver neuropsychological intervention services as well. So how do these Canadian guidelines differ from the guidelines for the state? So Canadian applicants do not need a formal 2-year postdoc, but you need all the components that would normally be in that 2-year postdoc that are essentially characteristic of the fellowships that you would find in the United States. And so the Canadian guidelines are aimed to provide more flexibility, given that we don't have many formal residency fellowship programs. There are a few things to consider when you're doing it this way in the absence of a predefined formal two-year formal postdoc. If you are considering pursuing board certification, you and your fellowship supervisor or your postdoctoral training supervisor should draft a training program at the outset to ensure that you're meeting the ABCN criteria. So that is to have a structured program of didactics, as well as structured supervision that you're getting on every case and for that supervision to be by a neuropsychologist. It does need to be a rich and educational two-year training period. It can't be an informal kind of on-the-job experience that you're doing just out of grad school. They will look to make sure that you have all the different educational didactic components that are associated with your postdoctoral work. And so that highlights the importance of the next point. You really want to document everything that you're doing during your postdoctoral training period, and you want to be able to show how this meets the ABCN criteria. All applications from Canadians are reviewed on a case-by-case basis, and certainly the more information that you can provide in your application as to the varied clinical experiences you've had, as well as didactic training, programming that you've had, the better. I will say the nice thing now more than ever, probably, there are many, many resources to help you go through the board certification process. And this really helps make the whole process way less daunting than it might seem. You know, starting even with the early entry program and going from there really helps to make the whole process a lot more easy to conceptualize and follow as you navigate the different steps. And so other resources that are, we've made links to two associations here. So one is for the Society for Clinical Neuropsychology, or SCN. And if on the SCN website, there are a copy of the Houston guidelines available, and also other information related to your training in clinical neuropsychology that might be helpful for so things around taxonomy, competencies, and education and training. There's a lot of educational information about those things on the SCN website. Another website that might be useful is the Association of Neuropsychology Students and Trainees, that will have some more information related to the different aspects of clinical neuropsychology and training in neuropsychology. I'm not really going to go over this too much. So this slide relates to taxonomy, which does become important in terms of, okay, if you are pursuing board certification in neuropsychology and determining whether what you have done would be considered a major area of study versus, you know, was neuropsychology a major area of your study, or was it something more of an exposure, right? So if you've done one practicum in clinical neuropsychology, that's not necessarily what one would describe, and then, you know, attempt to go through the board certification process, that's going to be much more challenging, and probably, you know, compared to somebody who's had neuropsychology as a major area of study. So knowing what constitutes what is kind of, I think, more helpful. So here on the across here, you can see the different stages of training. So doctoral, your PhD, internship, postdoctoral period, and then post-licensure. And then what would constitute a major area of study at each of those stages. So for instance, a major area of study in your PhD in neuropsychology consists of a minimum of 3 neuropsychology related courses, having 2 formal practicum in clinical neuropsychology, having completed additional coursework, practicum and didactics in neuropsychology, as well as a dissertation or research project in neuropsychology. So this just allows you to gauge where you might be with your experience as to, are you more at the exposure level versus experience level versus emphasis level versus major area of study level. And so that will help you gauge, as to whether it makes sense for you to apply for board certification if you're considering it and even practicing in the field of clinical neuropsychology. As you actually go through the American Board Certified ABAP process, one of the first place you're going to start is always just the general ABAP website, which we've included here. So this will provide you an overview of ABAP and what board certification means to psychology in the public. It gives you a summary of description of the requirements to enter ABAP as well as ABCN. And also it contains important forms that you'll need to fill out each step of the way. So you kind of start with the ABAP website and you get registered there, but then you also get familiar with the ABCN website, which has a lot of the specific requirements and information related to, of course, ABCN, the ABCN process. It goes over a detailed description of what the requirements. It goes over a really nice overview of the written exam, how that works in terms of dates and deadlines. Certainly there's answers to frequently asked questions, and there's also links to other related organizations, so ABAP as well as the AACN website. So these are going to be two of the major sites that you consult with a lot, is the ABAP as well as ABCN. On AACN, you're going to find a description of what the organization is. There are also different, there's information about an AACN mentorship program, as well as information about a guide that they put out for board certification, which I have, I'm going to show you some pictures of some of the study guides that they've come out with and which have become the main workbooks and textbooks for those who are studying to become board certified. Another key website for those going through the process and when you're preparing for your written and oral examination is what we call the BRAIN website. And this has all sorts of rich information. So it has study outlines, flashcards, mock exams, sample study schedules. It's associated with listserv for others who are going through the process. There's advice on how to approach each step of the certification process. And there's also the opportunity through this website to be connected with other people who are studying at the same time as you are, and to be group and to actually form a study group if you'd like. So the BRAIN website is actually a very rich website when you are kind of knee deep in the process of writing the exam and studying for the exam and every step that follows. So yeah, these are some of the essential workbooks or guidebooks that have come out, and as I noted, are from the American Academy of Clinical Neuropsychology. So this one is a really nice overview by Armstrong and colleagues. It's called Board Certification in Clinical Neuropsychology. It gives you a really nice kind of global overview of the whole process from front to back, different things you should be thinking about and consider. Easy to read, and it's a pretty quick read. These are two essential study guides that also have come out to help you with the board certification. So the one on the left is what most will use to help study for the written exam. So it's called the Clinical Neuropsychology study guide and board review by Stuckey and colleagues, and the second edition just came out. And this is a great book. It's a great study guide, not only for the written exam, but I find myself coming back to this guide even as I practice. So it has a lot of good information, nice overview of a lot of the conditions that we see in our field. And so it's a really nice, I recommend it to my trainees, whether they're getting board certified or not, because I think it's a really rich, excellent resource with a lot of good information. When you're studying for your orals, they've come out with another book. It's called the Neuropsychology Fact-Finding Casebook. And this is an excellent book to help you prep for your orals, where you are going to be given a case. And this book allows you to prep for that case and the type of case that you might get during the oral. And I can test from me and my colleagues who've gone through the process that both of these books we use diligently and were excellent resources. Okay, I'm just looking at time. So I'm going to kind of fly through the next few slides because I really want to leave some time for questions that you guys might have. And I know that there's some other board certified colleagues on the webinar, so they might also want to add some points that I might have missed, or just add their input. So definitely want to leave time for that. So we are a growing number in Canada. We're small compared to the States, but we are growing. I myself got, as Octavia noted, I recently went through the process, and I went through the last stage 3, in November of last year. So that's when I completed it. For me, my training was uniquely Canadian. So after my internship at Baycrest, I did my postdoctoral training here at the University of Manitoba, and that's where I received all my postdoctoral clinical training. And it was nice because I was in an academic center, so I had access and attended all the academic rounds that we have here at the university. And so, I kind of fell right into a really something that looks very much like a formal postdoc. It just wasn't formalized. And so I pieced together all of my training during that period, outlined all of the things that I did during my 2-year postdoctoral training period, and submitted that as part of my application to ABCN, and was approved to sit for the written examination. And so, I started the written examination in December 2019, and about a year later, I had passed and completed the oral exam. Octavio, who was at the start of this call, or webinar, sorry, is currently in the process of being board certified. And I don't know if he can, Octavio, are you able to jump in here?
Yes, I'm sorry. Oh. I had issues unmuting myself, but yes, I just want to quickly tell you guys a little bit about my story. I was born and raised in Colombia, where I completed my bachelor's degree in psychology. I got fascinated with neuropsych doing my practice at a medical center, and I started looking for opportunities to study abroad. At that time, I came across the Houston Conference guidelines for specialty training in neuropsychology in the States, and I thought that it was a comprehensive training model that I would follow to pursue my goal of becoming a well-rounded scientist practitioner specialized in neuropsychology. So I moved to the US shortly after graduating from university, and took 5 years to improve my English and gain research experience to become competitive for grad school. I was privileged to complete my PhD, internship, and postdoc at my top choice programs, and to meet my better half, who happened to be Canadian. So we decided to move to Canada as we planned on having a baby and wanted to be closer to her family. So at the time, I was very concerned about securing a neuropsych position in Canada, and much more so in Ontario, given the limited number of jobs I was able to find. Luckily, I secured the best job at that time and have since been incredibly happy doing neuropsych and rehab in a very supportive working environment. I recently completed the required supervised practice by the College of Psychologists of Ontario to become registered in this province. Now, regarding my ABEP timeline, I actually did the early entry application during my PhD, submitted my credentials for review during my postdoc, and passed the written exam early this year. I plan on submitting my practice samples this semester, hoping to take the oral exam next year. So now, why bother? So I identify with most of the advantages already mentioned by Dr. Patel at the beginning of the presentation, but can also highlight three main reasons in my case. So number one, almost all my supervisors were board certified and instilled in me the importance of not only pursuing training in line with board certification, but also of becoming board certified as soon as possible after finishing my formal neuropsych training, given its advantages. The second one is that I want to be recognized by my colleagues and the public as a specialist practicing according to the highest standards in neuropsychology, and to remain competitive also among my colleagues, as lots of jobs in the US currently require board certification, and this will likely be the case in Canada in the next decades. Lastly, I'm interested in training and possibly becoming a training director of a neuropsych fellowship program, member of the Association of Postdoctoral Programs in Clinical Neuropsychology, which requires board certification for this role. So those are in a nutshell.
Great. We have the timelines and background of some other of our Canadian colleagues and what they've done. So Dr. Amanda Lamar, I think it's Lamar, and I'm sorry, Amanda, if you're on and it's not Lamar, but she completed recently, oh, she's here. Oh, she's, okay, great. Amanda, do you want to speak a little bit to your training? I didn't realize you were on.
And if you want me to.
Yeah, that would be great.
Sure. So I'm Dr. Amanda Lamar. So I did my training. I have a little bit of an unusual background for neuropsychology because I attended a clinical psychology PhD program at UBC where there is no specialty focus in neuropsychology, but I was exposed to a neuropsych practicum in my master's, and after that, I was like, this is the job for me. So basically, I looked to my mentors here to find out, what it is I needed to do to become a neuropsychologist, what kind of courses I had to take, what kind of practicum experiences and so forth, and really shaped my own graduate school training on the Houston Conference guidelines. So I did that legwork on my own with the support of my supervisors. To the point where I switched my PhD thesis and did a neuropsych focus for my PhD thesis when I hadn't planned on it as well. I did my internship in Calgary, and it was actually a general internship as well. However, I was able to carve out 50% time to do neuropsychology, as the guidelines suggest. And then following my internship, I did do a postdoctoral fellowship in the United States at the UCSF Memory and Aging Center. And I was actually there for 3 years for lots of reasons, but mostly because it was amazing training. So I did do a Canadian schooling, but then I did do that American postdoc. After I finished my postdoc, I worked for a couple more years at UCSF in oncology, and then I moved back to Vancouver area where I am from and where my family is. And I've been working as a staff neuropsychologist in 2 of the health authorities here. I have a kind of a long ABAP timeline. probably partly because I did move back to Canada, and I was actually on the fence about whether or not I wanted to pursue board certification and whether or not it was right for me, even though I had done all the other pieces of it. So after I moved back, I did do my credential review, and then I took my time and did my written exam, and I took my time and did my practice samples. And then I actually completed my oral exam last November when Dr. Patel did as well. So I have a slightly different look to this, but that's also to say that the fact that they give you 7 years is really helpful because, you know, we as clinicians, once you get into your working life, it can be difficult to carve out that time, but it is possible because they give you that long time frame. And I'll finish there.
That's a really good point, Amanda, to highlight is that once you pass your credential review, the board gives you 7 years to finish the process. So you don't have to do it all consecutively. Certainly, as Amanda noted, you're busy, you're doing a lot of things. And so you can kind of pace it out the way you'd like to. Certainly, I think people would argue to just keep the momentum moving as much as you can, because the longer you wait, the harder it might be to finish. But they do give you, you know, you don't have to get it done within 2 years. They give you a nice big period of 7 years to get it all done. Great. I don't know, is Emily on our webinar? Okay. I won't go through all her details, but I will let you know. So she did most of her training, I believe, in the States, and is now, though, currently at McMaster at St. Joseph's Healthcare Hamilton. Oh, she is here.
I'm here.
Oh,
Can you
awesome.
hear me?
Yes, I can. I'm going to throw it to you then to kind of describe your background a little bit.
The only thing I want to, hello, I'm here now. The only thing I want to say, so I'm from the US, but I came to Canada in 2014. But the only thing I really want to say is that if you're interested in applying to the only ABCN postdoctoral adult, I should say there are pediatric ones, but adult ABCN postdoctoral fellowship in Canada, I'm the person that you might want to contact directly. And my email address is emackill, like EMACKILL at stjoes.ca. So please reach out to me directly. And I'm the director of our lovely postdoctoral fellowship that we have. We have 2 fellows, one every year. So we're always recruiting 1 fellow each year. So that's all I want to say, because I have boring stats from the US that lots aren't going to apply.
No, that's great, Emily. And so we also will have Emily's email on the slides that you can reference. And I also want to underscore, so they have, St. Joe's has the first official formal postdoc. So, you know, it's not that we don't have any, we do have some. And so please consider that. If you wanted a formalized postdoc program, it would set you up beautifully for board certification.
Yeah, and if anybody has any questions, anybody who knows me or has worked with me knows I'm always available for questions about the process or just for some mentorship. I don't know if there's you know, a mentorship program as well, a formal one. I don't know if we reviewed that, but that's another resource. So anyway, yeah. Feel free to reach out to me. Love to hear from you.
Awesome. Dr. Ritchie can't join us today, but she she's my colleague here at the University of Manitoba, and she went through the process at the same time I did. And I will tell you, having somebody going through the process with you at the same time is awesome. You keep each other accountable. You create timelines for your studying. And so we had each other, and it was just a wonderful thing to have. And ABAP or ABCN will work with you. I think it's ABCN or AACN. One of the organizations does have a mentorship program. So They will connect with you with somebody who's gone through the ABCN certification process and identify an ABCN mentor for you. And then they'll also connect you with a study group. So if you don't have somebody in your immediate vicinity that's going through it, they will connect you with a study group from different people across Canada or the States that you can study with. I was part of those study groups, and they were extremely, extremely helpful. Dr. Trisha Williams, I don't know if she's on here. And she could speak more to the pediatric focus, given her background in pediatric neuropsychology. But not sure if she's on here, so we'll just keep going. Dr. Emily Dugan, who's here. Hey, Emily, can we can hear you now.
Great. Hi, everyone. So I'm not board certified yet, but I'm in the process of starting that. So I just finished my 2-year fellowship, and I'm actually doing a 3rd year of fellowship at Johns Hopkins as a transition into a faculty position. And so this is actually a good time for me to get a jump start on my credentialing for ABAP and everything. So I'm kind of from a different path. I'm American, but I came to Canada for my training in my PhD in the University of Victoria. And then I was undecided about staying in Canada or coming back, and I became a permanent resident in Canada, and I applied for internship in both Canada and the United States, but then ultimately matched in the United States and have continued my training here. So anyone who kind of also like the other Emily on who's called Dr. McCall, if people are kind of spanning the border and have questions about navigating that process, I'm happy to help them in any way.
Awesome. I think it just goes to show you, based on everybody who's been showcased here, there are many paths to board certification. And so, you know, all of us kind of highlight that with our own unique individual path into how we're getting there, or how we've gone through it. Okay, so we want to open it up to people who are attending and have listened. We thank you for registering and listening. Are there anybody, or is there anyone with questions, or yeah, anybody with questions or comments?
Yes, so there are a few questions that I'd like to spotlight. One of the questions that we had early on was whether or not postdoctoral training had to be a formal postdoc, or if supervised practice was sufficient.
Yeah, it's a great question. So I would encourage to answer that question and to really clearly understand the answer for the applicant to look at the Canadian guidelines on the ABCN website. So it can't just be a supervised, it doesn't need to be a formal postdoctoral experience or fellowship. But if it's not, your postdoctoral training or your supervised practice training has to meet several training guidelines. So you can't just be doing clinical work that's occasionally supervised. It has to be structured in a certain way that you're meeting all the Houston guidelines, so that you're getting exposure and attending didactics and participating in academic rounds, didactic seminars, that your cases are being regularly supervised by a clinical neuropsychologist, that you are doing some component of research, I believe, in accordance with the guidelines. But again, I would encourage you to go to the Canadian guidelines that are specifically on the ABCN website, because it outlines what that 2-year postdoctoral training should look like.
Great, thank you for that. We have another question in the chat, and that question is there any advice on how to obtain a US postdoc as a Canadian citizen? So for example, how to get a visa, eligibility to work in the US for 2 years.
Yeah, I will initially attempt to answer that question, and then maybe one of my colleagues can jump in. So one of the ways that Canadians can get into the States to do their fellowship is to apply to the ABCN matching program. Because many do accept Canadian applicants, and then you get a special visa to go into to do that fellowship through that kind of mechanism. I know that there are certain things you need to be aware of. I don't believe that VA schools, for instance, employ or can have Canadians. So you wouldn't be able to apply to VA fellowship programs. But, you know, I'm a little bit removed from that. I don't know, Amanda, could you speak to that a little bit more?
Yeah, so I didn't apply to too many postdocs in the States, but you're right. I believe you can't work at a VA, and you would know that if you were applying for internship, you would have had those same issues. Where I trained UCSF, they just have this huge department that deals with international students and international employees, and so getting the visa set up, I didn't really have a lot to do with the process. I was on a J visa, which is a student working visa, and the university office set that up for me. So I think if you apply to somewhere big, like a big institution, the likelihood of obtaining a visa would probably be easier than like a small state hospital somewhere or something like that.
Yeah, and my sense from colleagues that have gone over is that it's kind of a step-by-step. So once you get, if you do a fellowship in the States, it kind of, you then start to find out what you would need to work in the States. And I believe it's certainly possible, because we have Canadian colleagues who've gone over and done that. But yeah, working with your host institution to help facilitate what you need, it seems like the way to go.
Another question from the chat is, assuming that this person has efficient and possible, or is as efficient as possible, how long does it take to get through board certification? So from the day that they submit the application to the day that they get certified after completing all exams?
Yeah, that's a great question. So if you kind of think about it, you need your PhD. After your PhD, you need at least 2 years of postdoctoral training that meets the guidelines. And then if those are accepted and passed, you can move on to stage 1. And really, if you start studying for your written examination right away, you kind of, the written examination is set, I think, 4 times a year. So you look up which one you would want to write, but you could write, as soon as your credential reviews pass, you can sit and write that exam at any of those timelines. So really, you could get that process done within a year to 2 years by the time you write your written exam to when you've passed your oral. So, 2 years after your if you did it all consecutively, that would be two years after your 2-year postdoctoral training. So you can get it done pretty quickly if you are very efficient.
So another question from the chat is whether the benefits differ for adult and pediatric focused neuropsychologists.
That's a great question that I don't know much about the pediatric subspecialty. I don't know if Brenda is on the call or on our webinar today, and whether she could speak to that.
I am on the call.
Oh, great.
Hi. Wasn't
Hey.
expecting to put my camera on, so excuse me. Do the benefits differ? In Canada, I'm not sure that the benefits differ. There is a pediatric subspecialty that you can go through after you become board certified in the parent clinical neuropsychology. That's another couple of steps, which we don't really need to go into today. But I would say that the benefits in pediatrics are the same as in adults. It's the networking, it's the confidence, it's the knowing that you're practicing the highest standards, all the things that Ronak outlined. And if anybody has any questions about the pediatric subspecialty, I'm happy to, talk about that. But I'm not sure that that's really the thrust for today.
Yeah, the benefits, it would make sense that the benefits are about the same, but in terms of specific process, we certainly encourage you to look on the ABCN website where they have process specific information about the pediatric subspecialty clearly outlined and what you would need to do if you wanted to go after that subspecialty.
I will just add that the written exam has a good balance of adult and pediatric questions. So it's really meant to be a lifespan certification. And when you go for your orals, there's 3 parts to the orals. One of them is a fact-finding case, and you may choose a pediatric fact-finding case or an adult one, depending on what your specialty is. And of course, when you submit your practice samples, you can submit either adult or pediatric cases.
Great. Thank you both for providing such good insight there. So we have another question in the chat, and this person is wondering, are there any opportunities to rewrite the exam or redo the oral exam if one is not successful?
Yeah, that's a great question. So you can, if you are not successful in passing the written exam, you can write it again. I think you can write it up to 3 times, but don't quote me on that. You'd have to check the ABCN website to make sure what it is. But you can rewrite the exam. And Brenda, do you know how many times?
Yes, 3 times is right.
Oh, okay, great. So there is an opportunity to rewrite, and we would encourage you to rewrite if you don't pass the first time. It's not unheard of that people may not pass. There's a lot of content that you do need to know. It's quite extensive, but certainly, everybody around you would encourage you to rewrite it once you've been able to perhaps study some more, spend some more time with the material. And so again, you would have some chances to rewrite. If you don't pass the oral, my understanding from what I can remember is you would have a chance to redo it as well. I think there is a chance to redo the oral. And what I'm trying to think of is whether they give you any feedback at that stage on things that you would need to focus on before you do it again. Am I right in that, Brenda?
Yes, you can, as long as you're within the 7 years, you can do each stage up to 3 times. And if you don't pass the orals the first time, you do get a letter, fairly general letter saying, we encourage you to come back and in the meantime, focus on these areas.
Right, okay. Yeah, so, if you don't pass any stage the first time, I would say don't give up. You have opportunities to do it again. And, that's actually the nice thing about it. I will certainly speak from experience. Everybody who I was connected with through the whole experience is nothing but supportive. People want you to do well. And everybody I've connected with through just helping me study, and then even your examiners when you're going through the process, everybody does want you to do well. And so that's the nice thing about going through the process. And so if you don't pass any of the stages, certainly we'd encourage you to try again.
So many people go through at least one of the stages more than once. I took my orals twice before I passed it. And then I went on to become president of ABCN, and I'm about to be president of ABPP. So my advice to people is give it a try. If you don't pass it the first time, just do it again. And don't, it's not an existential crisis.
Yes, very much so.
So we do have some more questions in the chat. So another question has to do with postdoctoral training. Would postdoc training in a private practice setting set up in accordance to the Houston guidelines be perceived as inferior or inadequate during the credential review?
It's a great question. I think I'm not sure if it would be perceived as inferior. I think, again, it's, are you able to show the board that you've met all the conference guidelines? And so did you have access to academic rounds? Did you participate in those rounds? What else have you done on the academic side of things to show that you are meeting the Houston conference guidelines? So whether it's a private practice or not, because I mean, some fellowships in the States are based out of private practices. I think it's, do you meet the full scope of training as outlined by the guidelines? And I think if you do, then all likelihood is that you would be accepted into the process of starting board certification. But if all you're doing is clinical work in a private practice and you're not really having any of the academic training experiences, then I think that's going to be tougher and may not pass the muster for what you need.
Great point. And we also have another question in the chat, and this is actually pertaining to one of your slides. So this person noticed that one of the slides mentioned that the dissertation has to be neuropsych focused. Is this a requirement? For instance, would a neuropsychology graduate program, but a dissertation in cognitive psychology be acceptable?
Yeah, that's a great question. I don't know if there's anybody who on this call who would have more insight into that. I think, oh, Brenda?
No, I was a credential reviewer many years ago, but I don't think there's any requirement for the dissertation to have to be neuropsych. As long as you went through a neuropsych program and took the right courses and had the right practicum and internship, I don't ever remember looking at the dissertation.
I would be surprised if that was the case too, because there are many neuropsychology trainees who may not have an explicitly focused neuropsych dissertation. I think that terminology might come from the taxonomy of whether you meet major, emphasis, or not.
Right, I think that's right.
Yeah, so I don't think so. And certainly cognitive psychology, I don't think it's a far stretch from there's lots of overlap with neuropsychology. So I wouldn't be as concerned as long as you're meeting all the other things that clearly established that neuropsychology has been a major area of focus of your training.
Great point. So while we're waiting on more questions to flow through the chat, oh, we just got one. So would continuing education courses or seminars offered by NAN count towards didactic training?
That's a good question. Anybody have insight into that? And I assume they're meaning during their postdoctoral training period.
I know that people who take the anatomy course through NAN, it does meet the requirements for neuroanatomy, but I wouldn't think that it would entirely replace the need for the didactic requirement. It's a good question. I don't entirely know the answer. I will say though that the credential reviewer from ABCN is often quite willing to talk with people about their individual backgrounds. What we don't want to happen is for you to get all the way through all your training and then submit your credentials and be turned down, not be eligible for board certification. So the earlier you have these conversations and plan ahead, the better.
Yeah, you could certainly submit an email to the board and ask that question, or get in touch with them and ask that question. I think that's an interesting question. If they're especially talking about within the to your postdoctoral training period, and if that's the way they're getting their didactic training, it may or may not be acceptable. It's worth inquiring with them directly about.
Those are great points. And we actually have another question from our audience, and that's how would someone who wants to work in Canada or do a postdoc in Canada get a visa for Canada?
Oh, that's a that's a great question. I don't know. I don't think I have a good answer. So does anybody else have some insight into this?
Octavio might know, he did it.
We also have Emily, and I'm just gonna ask.
Yeah,
you.
Emily or Octavio?
I can answer that. In terms of getting a visa, it's if you are somebody who's coming to Canada to get it, if you're accepted into a program or you're accepted into a job, it's relatively smooth. Like we just had it happen. Our fellow is from the US this year, so he was able to get that visa really easily. So if you are coming from the US to Canada, you just you're just accepted as a worker. Did that help? Did that answer?
Yeah, no, that's great.
Yes, that's a great response. And while we're waiting for more members of our audiences to submit questions, we actually have quite a few questions from our pre-webinar survey. So I'd like to try to get one of those answered if that's okay. So one of the questions is, if supervision does not come from a board certified neuropsychologist during CPA accredited neuropsychology training, can you still become board certified at a later point in your career?
Yeah, so it's a great question, and the answer is yes. I did all my training here in Canada, and I think only one of my supervisors was formally board certified in the many years of graduate school, during my graduate school training. So your supervisors in clinical neuropsychology, if you are here in Canada, do not need to be board certified for you to be eligible for the board certification process. Certainly, if you sign up for the mentorship program, the nice thing about that program is that they're going to link you up with a board certified neuropsychologist who can help you with the actual different stages. So the written exam, the oral exam, the work samples and the oral exam. So you will be linked with a board certified neuropsychologist through the mentorship program, but your actual supervisors during training don't need to be. And that's also that's also applicable to your postdoctoral training. So my supervisors here weren't board certified, but because I was being directly supervised by them and they could speak to my clinical training, my didactic training, my research, I passed the credential review because I met all the Houston Conference guidelines.
Great. So we have another question, and this involves the best way to learn about available postdocs within Canada. Are there any recommendations for how to keep your eye out on that?
That's a good question. Emily might have more insight to that, if there's any resources specifically for Canadian postdocs.
Yeah, I'm not sure. Brenda, you might be able to help me out too. I'm not sure if there's any Canadian specific sites or listservs that help with that.
Well, as part of the prep from this, we were trying to pull together lists of Canadian postdocs. I know there are 3 or 4 absent postdocs in Canada. Emily's at St. Joe's, Sick Kids, Calgary, Alberta Children's Hospital.
Yeah.
Is there any others?
No, but I think, isn't there a postdoc at Toronto Western? It's not
There is.
absent, but it's a structured postdoc
Right.
for a fellowship.
Cheers, the head injury, community head injury rehab organization, Toronto, has a board certified neuropsychologist, and she often has a postdoc, although I don't think always.
If you're a member of ANST or SEN Division 40 of APA, if you're a trainee in Canada or the United States, you don't have to be a member of APA to be a member of SEN. And if you're a trainee, it's only $10. On that listserv, ANST does an amazing job of advertising essentially every postdoc that we find on every list in North America. So if you want to know where postdocs are, if you're a member of the ANTS list, you will probably hear about it if it exists on that list.
And I will just put a plug in for the Canadian postdocs. Very often in my past experience, we didn't get very many Canadian applicants. So a lot of the applicants came from the US. So if you're a Canadian and you are interested in doing a 2-year postdoc in clinical neuropsychology, I would really encourage you to apply.
Yep, my experience as well. We because of the way the hiring process is, we prioritize Canadian applicants because of the government as well. So you're prioritized as well.
Yeah.
Thanks so much for that. Now, we do have another question, and we have room for about 1 or 2 more before we end for today. But this next question is, if you become board certified in the United States, does it transfer to Canada, or do you have to take additional exams?
My understanding is that it's completely transferable. Once you're done, you're done. There's no any more milestones to meet once you move to one country or the other.
Great. And another question that we have from our pre-webinar survey actually has to do with any advice for new doctoral students interested in board certification.
I mean, I'm sure we could all give our own pieces of advice. Mine would be to echo something that we said in the presentation, and that was super helpful for me. I think if you're thinking about it, the earlier you get started and organize yourself, it kind of you can kind of lay out a nice roadmap. Gives you a nice timeline for you to go and check off each milestone. For those who are still in your training, the early entry process is a great process to kind of get organized around it. And so my thing would just to be start early and think about it early so that you're not ever looking back and said, oh shoot, I missed that, and needing to backtrack. So that would probably be my greatest advice for new doctoral students, is to start early and get organized early.
Get a mentor, reach out to, sorry, Brenda, reach out to any one of us that are board certified, and we're all here to help. So yeah, I would say mentorship is also really important.
So I was going to say something similar, which is, this is really a nice community, and it's a supportive community and an encouraging community. And like, where else could you just reach out to somebody who's mid or late career and have a conversation and get advice and mentorship throughout? And that's what this community is, both in the States and in Canada. And getting ready for this, I've gotten to know some of the board certified people in Canada. It's a great group. You're a great group. I think you did a great job, Ronak. Thank you.
I agree.
But I will echo that. And I'm just newly joined. It's kind of like a nice club to be part of, because everybody's just so nice and they're willing to connect and they're willing to help you. And you always have somebody to reach out to at any point in the process. So.
Thank you.
Amanda, any insights? Or oh,
I think that was extremely helpful. And I think now is a great time for us to go ahead and conclude our webinar today. I just want to remind the participants to complete that post-webinar survey. I've posted the link to the chat once again, and we look forward to anything that you guys might add when you reach out to our contacts. Thanks again for attending.
thanks, everyone.